Can you hear me now? Okay. Good afternoon and welcome to all of you. And thank you for coming this afternoon. This is the second in a series of workshops that the End of Life Committee, which is a ad hoc committee, meaning, we're not a permanent committee yet. We are presenting today the part about the POLST, Advanced Directives and Emergency Responses here at TLG. Yes. My name is Flo Creighton, and I'm the president of the Residents Council. And thank you for reminding me. Okay, and this is the second. We hope to have a third workshop in the early part of 2023, which will focus on how to talk about these difficult topics sometimes with our loved ones, our families, our designees, and you will be welcome to invite your families, children, relatives, whomever you deem appropriate to bring it to that third workshop. Today we have both Charmaine Verador, who's the Director of Wellness and Assisted Living, presenting, as well as our Executive Director, Bradley Bergignon, and I turn it over to them.
Good afternoon, everyone. I'm Charmaine, and I am the Assisted Living and Wellness Director. Thank you for coming. Today, I'm going to talk about the much-awaited POLST and a little bit about the Advanced Healthcare Directives. In hopes that, I'm sorry? Oh, okay. In hopes that I can give you a little insight on what they are, because they're really very important. Okay, so POLST is the physician's order for life-sustaining treatment. Let me go through the whole slide, and I'll explain as I go. Let's see. So part one of our presentation would be explaining to you what is an advanced healthcare directive, what is POLST, and how are they different. An advanced healthcare directive is a legal document that provides guidance and instructions when an individual is no longer able to make healthcare decisions. It allows you to appoint an agent who has power of attorney for healthcare to make care treatments decisions on your behalf and give instructions about your healthcare wishes. It will help ensure your wishes are followed and will make it easier for your loved ones as they try to follow your wishes. So what are you going to do if you don't have an advanced healthcare directives, or what will you do if you want one, right? So first, you're going to have to talk to your family. You're going to have to appoint your agent. Let's say that person will be the one that's making the decision for you, or the one, if you can speak for yourself, and you have to let them know your wishes. And then you have to fill out the advanced directive form. The advanced directive form has to be signed by 2 witnesses, or you can have it notarized. After everything is all done, you're going to have to provide a copy to your doctor's office or to your healthcare providers, or to us, or to the community. Provide the copy to your agent. Provide a copy to your your important loved ones. If you wish, you can keep a copy for yourself. And of course, regularly, you're going to have to review and update this. Where can you find a form, or when can you find an advanced healthcare directive? There are a few options. You can look online. There are also a lot that are available. Sometimes your doctor's office, they do have copies as well. Okay, POLST. What does POLST mean? So POLST means it's the physician's orders for life-sustaining treatment. POLST is a medical order that is signed by your physician. It is printed on bright pink paper. Again, it's signed by your physician, and you have to sign that as well. And it serves as a complement to your advanced healthcare directive. It's like your portable medical order with specific instructions that first responders can refer to when there is an emergency. For example, if an individual becomes unresponsive, the first thing that the first responders will look into is the first section of your POLST. I don't know if you can see it, but it's the first section where it says CPR. The nurses or the paramedics, on the first level, it says attempt resuscitation. That means if you select that, that means that the nurses or the paramedics will do the full code or will do the full resuscitation in you. If you select do not attempt resuscitation, it means that they will allow natural death to happen. The rest of the sections is just more orders from you and from your doctor. This is what they're gonna follow when you are already in the emergency or in the hospital. Is the POLST or the physician's order for life-sustaining treatment different from advanced healthcare directive? Yes, the advanced healthcare directive is more detailed. The POLST, like I said earlier, it's more of a compact and a portable order, because obviously you have this at hand. When we call 911, most of the time they ask for the pink form, which is the POLST. Where's the POLST? Is what they always ask us. An advanced healthcare directive allows you to choose the person you want to speak for you and provide a general guide to what you want. Also, the POLST is for older adults and the seriously ill. The POLST tells you exactly your wishes about your certain medical treatment. For example, I don't want to be resuscitated, or I want my full treatment. The POLST is also a signed medical order, so your doctor signs that, and your healthcare team can act upon that. Your healthcare team can act upon. The POLST goes with you to your home, your hospital, or the healthcare facility. So it goes wherever you go. Again, these are just differences. The POLST form, as I've said, is a medical order. Advanced directive is a legal document. It has to be notarized or witnessed by two persons. Who completes the POLST? It's your healthcare professional and you. It's usually signed by your doctor. In the state of California, it's signed by your physician. In others, it varies from state to state. The advanced healthcare directive is, primarily, the individual signing it, and then it's witnessed. So usually the doctor doesn't sign that. Who needs one? Any patient considered to be at risk for life-threatening clinical event because they have a serious limiting medical condition, which may include advanced frailty. For the advanced healthcare directive, all competent adult can have one. For both your POLST and your advanced directive, completion is voluntary, so you may choose to have it, you may choose to not have it, although it's always recommended. Appoints a surrogate. For the POLST, no. For the advanced directive, you have to have a durable power of attorney or your agent. Can patients surrogate complete change or void? For the POLST form, in most states, yes. For the advanced directive, no. For the POLST form, what is communicated? It's a specific medical orders. Do you want to be resuscitated? It's pretty much yes and no. For the advanced healthcare directive, it's your general wishes about the treatment that you want. Can emergency personnel follow your POLST? Yes. The advanced healthcare directives, no. For your POLST, it's easy. It should be easy to be located. The patient will have the original, or the resident will have the original copy. We also have a copy of it, or your primary care physician should also have a copy of that. And this copy can also be in a registry if the state has a registry. For advanced healthcare directive, this might be difficult depending on where you keep your advanced healthcare directive. We recommend that you give us a copy, although sometimes you have your copies, and you can, like I said earlier, you can give it to your family members or to your agents or to your loved ones. For the periodic review, a healthcare professional is responsible for reviewing, your doctors, your physician is responsible for reviewing your POLST with you, because they're really very good at explaining this. And for the advanced healthcare directive, it's up to the individual as to how often you want to review it. So this is just the section that I was explaining to you about earlier. This is the first section. So when an individual is or becomes unresponsive, the paramedics or the nurses automatically looks for the pink form or for the POLST, and they go look at this first section, which says attempt resuscitation or do not attempt resuscitation. And this one is just medical interventions, as to, when you go to the hospital, your pink form will be transported with you by the paramedics and will be handed over to the emergency department as to where they're going to review all this and respect your wishes as you have included. Okay, do you have any questions, Mrs. Roth? Yes. Yes, and you can write more instructions on the section D of your POLST.
Where do the emergency, the EMTs or your department, where do you usually look first for the POLST?
So thank you. That's a really very good question. For our memory care and assisted living residents, we do have copies of their POLST, and they do have their individual charts. We actually are compiling all the POLST, and we put it in one binder so that it's easier for us to locate it. For independent living residents, Bradley is going to discuss about where you should put it, all those good stuff.
So here's Charmaine.
Okay.
So I provided a copy of the POLST when I just moved in last May. So you have a copy somewhere? Do you refer to it?
Yes. So I want to give you okay, go ahead.
I'm independent living, yeah.
Yes, I wanted to give an example. So if you're an independent living resident and you provide us a copy, and for whatever reason there's an emergency, every time we call 911, they would always ask for the POLST. So if you do have a POLST with us, we go to your independent living chart, pull up your POLST, and we give it and make a copy, and we give it to them. One more question.
We will have another opportunity for questions in about 5 or 10 minutes.
I was told what to do with my pink copy of POLST, and that was to put it, and the initials say PO, put it on your refrigerator, upper left-hand corner. That's so that any emergency people from the outside can read there. It's either keep me alive or do not.
Exactly.
Yeah.
Yep, exactly. Thank you, and I turn you over to Bradley.
All right, thank you, Charmaine, and thank you for all those great questions. They are a perfect segue into the next section of this presentation. which is what role does the POLST play here at the Terraces of Los Gatos, and what as residents you should all be aware of and should be doing with respect to the POLST form. So the POLST is an integral part of the resident care that we provide here at the Terraces. A complete, current, and easily accessible POLST form can prevent unwanted or ineffective treatments and reduce suffering and ensure that your wishes as residents are honored. As Charmaine mentioned, residents in all levels of living should have a complete, current, and easily accessible POLST at all times. The POLST can be updated at any time. Residents should review their POLST forms regularly, at least on an annual basis, and more frequently as there are life changes. It's always good to revisit the POLST frequently. The POLST is strongly recommended, but it's not required. Residential living residents should store their POLST on their refrigerator. And I'm going to talk about this a little bit because I know over the years here at the Terraces of Los Gatos, some of you may have been told differently. Some residents may have been told, keep it in your medicine cabinet, keep it on the back of your front door, keep it on your refrigerator, tattoo it on your arm. All of those things, with the exception of maybe the tattoo on the arm, are good ideas, but really the best and our recommendation is to store it on your refrigerator. And there's a couple of reasons why. The most significant reason is that throughout the healthcare industry, throughout the healthcare continuum of care, that is the place where emergency responders are always trained to look for a POLST form. So if there's one in your medicine cabinet, they may look there when there's an emergency, but they're always going to look first at your refrigerator. So, ta-da, there's a picture of a POLST on a refrigerator. At the end of this presentation, just on this table that's in the back of the room, we will have copies of blank POLST forms for anyone who may need them. And we will also have, there's just these little plastic sort of inserts with magnets on the back. So if you prefer to keep it in one of those inserts and then stick that on your refrigerator, you're welcome to take one of those as well. It's always a good idea to keep multiple copies together. And you'll want to make sure that if you do have multiple copies there, that they're all the same and they're all the most current POLST. Because when you have an incident and emergency responders come, they pull out the POLST form and they take it with you as they take it with them as they bring you to the hospital. When you get back, very rarely our experience shows that the POLST makes its way back with you. So always good to have at least a couple of copies on hand at all times. Also, another good recommendation is to add a copy of your current medication list with your POLST form. So again, not a requirement, but it's a good idea to keep that with your POLST form as well, because that's something else that it would be great for emergency responders to have easy access to. As I mentioned earlier, you can pick those up at the back of the room before you leave today. We also have just kind of a little cover page there. You're welcome to pick up one of those. If you don't want to have your POLST on display for everyone to see, that may come into your kitchen. You can slide that right in front, and then it should be clear that your POLST is located behind that form. So where to store it, we've talked about this, but all the residents should provide a copy to the wellness department. And as Charmaine mentioned, we actually keep electronic copies of all of the POLST forms that we have for all residents in the community. There's a binder that is nearly complete. As Charmaine mentioned, we're compiling all of the POLST forms and having copies available at the concierge desk, just to make sure there's easier access, especially for our assisted living and memory support residents. Yeah, we do not have the copies of the POLST forms at the concierge desk for independent living residents. We're evaluating to see if that may be beneficial and may be feasible. But for independent living residents, really, the most important thing is to make sure that there's one readily available in your apartments. As Charmaine mentioned, whenever there is an emergency, we will get a copy as quickly as we can to provide to the emergency responders. If it's already there in your apartment, it makes everything a heck of a lot easier. If you've updated your POLST, just make sure that you replace the existing copies that are in your apartment, remove the old outdated copies, and make sure that you provide the wellness department with the new updated copies. Medical ID bracelets. We've had a lot of questions about medical ID bracelets and what role they play in this whole process. So according to the California Emergency Medical Services Authority, the most accurate form of identifications for patients outside of licensed facilities is a medallion or a bracelet worn by the patient. So I know many residents have these types of medallions or these types of bracelets, and they could be very beneficial and very valuable. One thing to be aware of, though, two things to be aware of. The first thing to be aware of is there are only 3 approved medical medallion providers for the state of California, and they're listed there. You may find others online, but they aren't necessarily approved by the state of California. In licensed facilities, such as the Terraces of Los Gatos, all residents are considered full code, meaning CPR, meaning all interventions will be utilized in an emergency unless there is a physician's order that indicates otherwise. So what that means is a medical ID bracelet, a Post-it note on your refrigerator that says "do not resuscitate," or a tattoo across your chest that may say "do not resuscitate." Legally, in licensed facility like the Terraces of Los Gatos, our team members cannot follow those directions. So it has to be through a signed physician's order that you do not want all possible life-sustaining measures. Does that make sense? Questions? Okay. We'll open it up for more questions now. Cindy's got the mic. Thank you.
So I understand, I was told by Kaiser Permanente that if you call 911, they are trained to automatically resuscitate. So if you don't want that to happen, to not call 911.
Can you say that one more time? I don't know if everyone heard.
Maybe if you take your mask down or closer to your mouth. Yeah.
According to Kaiser Permanente, if you call 911, they are trained to resuscitate. If you do not want that to happen, do not call the 911 in the first place. That's what Kaiser told us.
So I don't know if I totally agree with that, but you're right in that they are trained in an emergency situation. They'll do CPR and they'll do all life-sustaining measures, unless there's a clearly available POLST form. And so I think that's why this POLST form is critical, because once an emergency responder has that POLST form that says no CPR, allow natural death, then they should be trained to not initiate CPR or other life-sustaining measures in that situation. Les.
Is there a specific procedure within our facility here for someone who is not in the department and experiences a emergency in a place where the POLST is not readily available? How does TLG respond to that?
Thank you. That's a really good question. Because if there is an emergency, hopefully, in a perfect world, you're in your apartment, you're right next to your POLST form, and everything is hunky-dory. The chances of that happening are probably not 100%. And there certainly are medical emergencies that take place throughout the community when you're not in your apartment. And so as Charmaine mentioned, what we have done over the course of the last few months is we've worked on making sure that all of the POLST forms are uploaded into our electronic medical record system. And so when there's an emergency, a wellness nurse would immediately respond to the emergency while also communicating with one of the other wellness nurses that's on duty, who will then immediately go to the medical records to review the POLST, communicate to the nurse what those wishes are, and then print out a copy of that POLST or grab a copy of that POLST and bring it to the location of the emergency. Another question here.
I have a comment. The reason I do not wish to apply CPR is that there is about 6% of the physicians do not do it themselves. So I don't understand why there should be a full code here.
Yeah, this is a good question. And so the comment was, well, do you want to say it one more time? I don't want to say it incorrectly.
Okay. My comment is that I do not wish to apply CPR to myself because 6% of the physicians do not have it applied to themselves.
So I think what you're saying is physicians, what percentage do not? 6% of physicians do not wish to have CPR themselves.
Any other, Patty?
There is, when I filled mine out with Kaiser Permanente, they showed me there was another section where we could make a caveat to that. So that if your incapacity is temporary because of an accident or something that put you in the hospital temporarily, they can keep you alive.
Yeah, thank you for that. And I think there was an earlier comment, related comment, and that's true. There is space to provide additional requests or additional information about what your wishes are. For the purposes of the terraces of Los Gatos, really the most important thing while you're here at the community is that first section, section A, related to CPR, because all of the other things about enteral feeding or other life-sustaining measures, obviously we wouldn't be doing here at the community, but it's important information. Judy.
How can I find out if you have a copy of my POLST?
Charmaine, our wellness director, you can touch base with Charmaine, or you can contact the wellness department either by going to the clinic, or you can send an email to tlgwellnessnurses@humangood.org. I think we'll take one more question and then we'll move on to the next section.
Hi, I'm Helen Cochran, and now I forgot my question. What about the weekend? Is someone always here on the weekend?
Yes, good question. So we have wellness nurses and medication technicians available 24 hours a day, 7 days a week. All right, we'll take one more.
A duplicate copy, say for instance, we carry one in our car and stuff like that. Will they accept that, or does it have to be that particular colored form?
A good question. So copies of a signed POLST form are acceptable. So keep multiple copies in your apartment. It's recommended if you make copies that you do it on a pink piece of paper, and we have some available if needed. But if you have copies and you bring copies with you, and I think that actually speaks to a really good point of it is always a good recommendation as well to keep one with you at all times. So if you have one that you fold up and you keep in your, keep in your pocketbook or keep in your wallet, maybe have to have a big wallet. But it is a recommendation to have one with you really at all times. Thank you for that. We'll now pass the time back to Charmaine, who will talk a little bit about emergency medical response procedures here at the Terraces.
Thank you, Bradley. So always remember that a complete, current, and easily accessible POLST form plays an integral role in our medical emergency response process. So what are we going to do if we have an emergency or we see somebody having an emergency? At the Terraces of Los Gatos, I believe there have been questions about what are we going to do if we have an emergency? If it is a life-threatening emergency, meaning there is a sudden or unexpected onset of a condition which is life-threatening, for example, someone becomes unresponsive. I'm going to use that example again. Or you see a person that's requiring medical emergency. If you have access to a telephone, call 911 immediately and press your emergency pendant. Because if it's a life-threatening emergency, even when you call your doctor's office, they always says for life-threatening emergency, please call 911. So please call 911 when you have a life-threatening emergency, then press your emergency pendant or pull your emergency cord. To press your emergency pendants, you have to press down for 3 seconds until you feel that vibration. Okay. What about if it's not life-threatening emergency? One example, if your spouse or you've fallen from your bed or while you're walking, you're fallen, go ahead and press your emergency pendant and the nurse will come and respond, will respond to the emergency. Sometimes, conditions escalate. For example, if you have fallen and then all of a sudden you notice that you're bleeding or you can't get up and you're having a lot of pain, if you're able to call 911, please do so. But the important thing is you press your emergency pendant button or pull your cord when you're in your bathroom or in your apartment, and we will respond to you. We do have licensed nurses 24 hours that will respond to emergencies. How about if it's a non-emergency medical need? For example, I'm having a bad headache or I'm having cough or I'm not feeling well. You can always call the wellness hotline at that number and we can have a nurse visit you at your apartment. I will have Bradley go through the scenarios very quickly. Okay.
All right, can you hear me? Okay, thank you, Charmaine. What we're gonna do now is we're gonna go through some scenarios, okay? And hopefully this will be an interactive process. So for each of these scenarios, we're going to discuss what the residents involved in the situation should do. And then we'll discuss what the TLG wellness team would do in that situation. Make sense? Okay, so scenario number one. Cindy, do you want to read it for us since you've got the microphone?
George and Bessie are eating dinner in a residential living apartment. George notices that Bessie starts choking and having trouble breathing. What should George do? And what would the response look like?
So if you are George having dinner with Bessie, she's very nice, but she starts choking. What should you as a resident do in that situation first? Correct. There was a lot of really good comments. The most important thing from our perspective for you to do is call 911 immediately. Some said pat her on the back. Some say do Heimlich maneuver. I will leave those decisions up to you personally to make in those situations, depending on what your skill sets are and what you've been trained to do. But we want to call 911 because we want to get emergency responders there right away. And then what else would George want to do in this situation? Push the pendant or pull the cord. And how long does George need to push the pendant down for? Roughly 3 seconds until it vibrates. That's when we know it's been activated. Charmaine, what happens once that pendant's been activated?
So once that pendant is activated, it will send a signal to the nurse's pagers, and it will say, a call is being, there's a call in apartment so and so. And so what they do is they treat that as an emergency. And so they go to the apartment and assist the resident. Now, I just wanted to add that this scenario is in a residential living apartment. Now, let's say, for example, you see somebody that starts choking in the dining room. I know you all have your cell phones. Please don't call 911 because we do have staff member in the dining room that are ready to assist and are ready to activate emergency response if needed. So in the dining room, if you're with a lot of a staff member or team members, they will be able to assist very promptly in the dining room. But if you're in your own apartment, yes, you call 911. But once you activate that emergency pendant, we're going to come and respond to you right away.
And one additional thing to mention is that, as Charmaine mentioned, if you're in your apartments, it'll say, the nurses will get a page that says resident is in apartment XYZ. There's also, I don't know what the official word are, repeaters or sensors throughout the community that will give us the location if you may not be in your apartment. So it'll tell us who the resident is and then the location throughout the community. Now, if you're outside of the community, we won't know. So you'd have to call 911. So the question was if the wellness nurses have keys to the apartments. And yes, the wellness nurses would be able to get into your apartment. Judy. What if somebody is in the garage or in the basement? Use your pendant. If you're able to as well, there are telephones, a couple of telephones in the parking garage that you could utilize as well. But yeah, you may not have cell coverage inside the garage. In the back.
What if you're in the rose garden?
We'll hear you. So if you're in the rose garden, same thing, use your pendant. Yeah, have your pendant with you, utilize it, and we will find you.
A comment on that, the assisted living pendants are only good for in this building. If you're outside and do your pendant, nobody gets called. It goes to the lodge resident assistants, but they don't know where you are.
Ooh, thank you for mentioning that, and so the comment was for assisted living residents, the coverage zone is within this main building, but not necessarily outside of the building. So thank you for that. Good to be aware of, and that's something we can look into actually a little bit more.
I just had a visitor from Florida who wore a pendant that would have covered her if she pressed her pendant even while here.
Yeah, something for consideration. Thank you for mentioning that. Okay, we're gonna move. We'll take one more comment here and then we'll move on to scenario number 2.
Well, I have a friend who has, not a member of the terraces, but she had something that she wore around her neck and she wore it to bed at night. Apparently she rolled over, and by the time that she was fully awake, the police were at the door, her next door neighbor was there, and her daughter was desperately trying to get a hold of her.
Yeah, I mean, there's definitely, I mean, I don't know the numbers, but Charmaine could attest to, there's quite a few false alarms, if you will, which is okay. We'd much rather have a few false alarms than miss actual alarms. Okay, we're gonna move on to the next scenario. Cindy, take it away.
A resident is walking down the esplanade and they see someone on the ground who does not appear to be moving. What should the resident do, and what would the response look like?
Okay, so you're walking down the esplanade, you see someone off to the side, they're laying there, you're not sure what the situation is. As a resident, what should you do? Press your button. Press your pendant, hold it down for roughly 3 seconds until it vibrates. Anything else? Stay there with them. That's good. Do you call 911? Probably, yeah. I think it's probably a good idea, but I think it depends on the situation. If you go up and you see the resident and they're clearly conscious and they said, "Oh yeah, I just tripped. I just need help getting up," probably may not be necessary to call 911, but definitely want to notify the wellness. Wait for the wellness nurse to get there. Probably not a good idea to help the resident try to get up or do anything else until the wellness nurse gets there to help assess the situation. Scenario number 3.
Bessie wakes up in the morning, looks over at George and sees he's not breathing. What
Bessie
should the
and
resident
George
do? What would the response look like?
Bessie and George are having a rough day, I'll tell you. But all kidding aside, this is obviously a very real possible scenario. What should be done in this situation? Call 911, press your pendant, and the response from wellness.
They will come to your apartment, the nurse will evaluate, and they will look for your POLST. So make sure your pulse is in good sight or in your refrigerator. They'll look for your pulse, and even when 911 calls, they'll also look for your pulse, and they will proceed with your wishes.
Scenario number 4.
A resident who is typically very active and independent notices that they are sleeping in much more. It is harder to wake up in the morning and they are feeling tired all the time.
Somebody said it sounds like everybody. Sounds like me some mornings. What should the resident do in that situation? Ms. Meijer, do you want to say that one more time?
Doctor, make an appointment with the doctor.
Make an appointment with the doctor. It's a great idea. Notify your doctor. Also, in addition to that, it would be a good idea to notify the wellness department. Now, this would probably fall under the category of non-emergency medical condition. So call the wellness department. There's a 24-hour wellness hotline. You can reach a wellness nurse, or there's clinic hours. If you want to wait till the clinic time, you can go during the clinic hours. Would be good to notify your physician. In these types of situations as well, what would happen is the wellness nurse would schedule an appointment with you, and then they would conduct an assessment and discuss the situation with you, and then work with you in partnership with your physician to decide what the best course of action could be. Maybe it's scheduling an appointment to go in and see your physician. Maybe it's requesting some lab work to be done to see if there's something going on there. Any number of things could be a possible referral for physical therapy or occupational therapy. So there's a lot that could potentially be done, but the first step is to notify the wellness department so that they can come and work through that situation with you. There's another possibility here. Let's hear it, Patty. Ms. Weber said, there's another possibility. Maybe you're just getting older. So yeah, that could certainly be a scenario.
Some of us have Pine Park. Where would Pine Park fit into this?
That's a really good question. So for those of you who may not be aware, Pine Park Health is a service that provides primary care services to residents here in the Terraces. So they have a care provider team that we work closely with and that work closely with our residents and act as and serve as their primary care providers. So in any of these scenarios, which we didn't get into this actually, but in any of these scenarios, our wellness team would notify if we have the information and you give us permission to, we would notify your physician to update them on what is taking place. And so that process would be followed, and we'd be contacting Pine Park Health, and then they would be giving you direction or giving our wellness team directions on how to proceed. Part 4, action items. If we haven't made ourselves clear about it yet, one thing that you should do is complete a POLST form if you do not have one. Again, it's a recommendation, not a requirement to live at the Terraces or Los Gatos. I don't believe anybody anywhere can tell you that it is a requirement anywhere to have a POLST form, but it is definitely strongly recommended. You should review your POLST form and make sure it still reflects your wishes. So if you completed a POLST form 5 years ago, probably a good idea to pull it out and see what the heck it says and see if that's still a clear reflection, an accurate reflection of what your wishes may be. Another step is to discuss it with your loved ones. And as Flo mentioned, the next presentation in this series of conversations we need to have will focus around how to have those conversations with your loved ones, because we understand that they can be difficult conversations. Place your POLST form and your med list on your refrigerator in residential living, and make sure that wellness has a current copy of your POLST form. And last but certainly not least, carry your emergency pendant with you. Questions? We'll go here and then
Do you need an official copy for a copy, or do you make it on your copier?
Just any old copy will do. If you give us a copy of your POLST form, we will make the necessary copies. But those copies that you keep in your apartment, they don't have to be any sort of special copies, just a photocopy. If you can do it on pink paper, the better.
Does it have to have a physician's signature?
Yes.
Good question. Yes. The POLST form has to have a physician's signature. If it does not have a physician's signature, we, Terraces de los Gatos team, nor emergency responders will follow any instructions on the POLST form if it's not signed by a physician. Great question.
Are we always sure that our emergency pendant will work? I mean, is it, sometimes it doesn't work, and how can you ever have it tested by the wellness?
That's a good question. There is a testing protocol that our buildings and grounds team does. I don't actually know what the testing frequency and protocol is. But the system that we utilize, it actually notifies us if any of the pendants go offline or if the batteries are dead. It notifies our buildings and grounds teams. We get an alert to go and address the issue. Mr. Barish.
Bradley, not a definitive answer here, but if we want to get more information about the viability of resuscitation in our age cohort, where do we go?
Oh, that's a great question. And I don't know immediately offhand, but we can provide, we're going to provide, so there are copies of the slides if you want to take them with you at the back of the room. We'll also put them up on TLG Connect. We can also see if there's some resources there that we can make available as well. Ms. Taylor.
There are two things. There aren't too many of assisted living people in this grouping. However, when you press that pendant, you will first reach an assisted living person, and then she transfers to the nurse. So there's a delay there. It's not immediately transferred to a nurse.
Yeah, that's a good question or a good comment. I appreciate you making that distinction. In assisted living, because the needs of assisted living residents, we utilize those pendants for everything to communicate to our team members, not just emergency situations. So the resident assistants or the CNAs would be the ones that initially respond to those pendant alerts. And then based on the needs of the situations, they would then radio to a nurse if a nurse is needed. Any other comments or questions for myself or for Charmaine before we pass it back to Flo?
I assume you do not want everybody to take several copies of your limited supply today, but will you have a supply somewhere where people can get one here and get several more later?
Yes, you can always request a blank copy of a POLST form from the wellness department. But I want to, one thing to distinction to make, it is best to complete one form and then make photocopies of that form. So it's not ideal to complete multiple forms. Plus your physician's probably not going to be super excited about signing all of them. But if you can just get one signed and get that signed copy over to us, we'll make copies.
Bradley, first, it would certainly be helpful to me if you repeated the questions before you answered them. Number two, would you repeat the hotline number and tell us how you find it on Cubicle?
Yes, so the wellness hotline number, I don't actually think it was up on the slides. Oh, it was, okay. 408 348 6982. There it is. So that's the wellness hotline. And that's a cell phone that one nurse that's on duty is always designated to carry with them. And where is that located on Cubigo? In the directory. If you go into the information cube, and then there's a staff directory button, it will show up there in that directory.
Well, in mine, I just tried it. It comes up with a Dropbox. I'll show it to you.
Okay, well, I can take a look at it.
Last one is, do you think it's worth sharing what you looked up and found for me?
Sure. Yeah, I think, well, so who here has an Apple Watch? Okay, a lot of us do. One of the more recent updates to the Apple Watch has the ability to notify emergency responders if you've had a fall, and then also if you don't clear it, to notify a list of emergency contacts. So typically it would be, your family members, your loved ones. And so the way that it works is the phone calls 911 and then it sends a text message alert to the people that are on your emergency contact list. The question was brought up recently of can we list the Terraces of Los Gatos as an emergency contact? And yes, you can, although I don't want everyone to rush out right now and put the wellness hotline in as your emergency contact, because we don't have a policy or a procedure really in place yet for that. It's something that we're looking into and to try to figure out how can we make sure that if we are listed as an emergency contact, all of our team members would know what to do and how to do it when such an alert would come through. But it is something that we are sort of working on a trial basis and see what we can learn through that process. Thank you for bringing that up.
Would it be possible for you to get a simpler number, not perhaps 911, but say 4433? Because in an emergency situation, I don't think most of us would have a nerve to sit down and try to find these and dial these 10 numbers.
Good question, but this number shouldn't be the number that you call in an emergency. In an emergency, you call 911 and you use your pendant. Okay. I'll pass the mic over to Flo to wrap things up.
I want to thank all of you very much for being here today. I'm hoping this was useful. If you have additional questions, please feel free to send me an email. And I will pass it on to the appropriate people to get an answer for you. I want to remind you that in the first quarter of the year 2023, we will be offering another workshop on how to talk within your family and or to your appointed person who will be making decisions for you so that you feel more comfortable talking to those you love about your end of life choices. And
one last thing, Bradley just ran to get the plastic sleeves.
oh, excellent.
So please don't leave until he gets back with those and you'll have that to put on your refrigerator.
And that is for people who are here presently. I want to recognize that we had some people who may have joined us on Zoom, and there may be people who will choose to watch this on channel 988, I believe it is. And if you need forms and you're not able to get them, check with the concierge. and the concierge should be able to let you know how to get them. All right? Thank you all for coming today. We look forward to having you come again.
Let me just put this. Thank you. Thank you. Thank you.